Sinead Gormagot, Ceann Corla. Minister, I think we're all acutely aware that across the country there is huge fear about the months ahead and the growing number of COVID cases and the dangers that many people are facing in the coming period. But I have to say the conflicting advice, the confused rules and regulations, the lack of clarity about what needs to be done and what we are doing from your government is feeding into that fear. And in this context, I would love to be able to say something positive about the announced winter plan, but I can't. I'm afraid I can't, because those on the front line of the health service, our nurses, doctors and consultants, have made it clear that this plan is not addressing the crisis. We could say it's a sticking plaster, but in reality, it's more akin to a policy of let's say a prayer and hope for the best. It's said that COVID-19 is ruthless in seeking out the most vulnerable, those with underlying conditions or with a fragility. And that's one reason why the fear in this country is so high. We have over 1 million citizens with underlying conditions, and their families and loved ones are also in fear. But this pandemic is also ruthless in exposing the weaknesses and indeed the underlying conditions in our economic, social and health systems. When we started this crisis last March, the then Minister for Health acknowledged that a two-tier dysfunctional health system was not fit for purpose in dealing with the pandemic. And he gave us the impression that the government was gone all socialist and was going to provide a one-tier system based on need and not on the ability to pay. But it's now clear that no such policy was ever planned, and even as the virus ploughs ahead, we remain committed to a two-tier health system. The winter plan will see us repeat a temporary purchase at very high prices from the private sector, with no vision of the permanent capacity increase that we need. Of the 1,500 new beds announced as part of the winter plan, which is to cover us from now till April, there seems to be only 528 actual new beds. Will the Minister confirm that, or is it more PR spin that they believe will fool the virus? That lack of real vision of a plan to fundamentally change the system is another reason why people have real fears. And compare these details with those at the frontline workers and what the frontline workers are saying. The Irish Hospital Consultants Association says we need an extra 2,000 inpatients bed at a minimum, and they've called for a doubling of the ICU beds, and we're getting an extra 17. The INMO have pointed out that many of the 300 beds opened under last year's Windsor initiative are now closed due to staff shortages. If we can't keep beds opened from last year because of staff shortages, and just one hospital in the east has 400 nursing vacancies, how in the hell can we be confident that we will staff this plan? In this crisis, a pandemic as this, we need emergency steps. We need to take over the private hospitals. We need to end the agency staffing and bring workers into the HSE on a permanent capacity on permanent contracts. To end this two-tier system and to show everybody that indeed we all are in this together and that there's real social solidarity.